Subcommittee.
All right, the meeting resumes. Please return to your seats. Does another member wish to speak on this item? No? Then I will put this item to the vote. For those in favor of EC 2014-15-14, raise their hands. Please raise your hands again. Hold it there. All right, please put down your hands. Those who are against, hands up, please. No. I'm of the view that the majority of members voting are in favor of this proposal, so the proposal is endorsed. Thank you. Next, EC 2014-15. Members are invited to recommend to FC the retention of the following supernumerary posts for another 3 years from the 1st of April 2015 or with immediate effect or with immediate effect upon approval of FC, whichever the later, in the Health Branch of the Food and Health Bureau, 1 AO Staff Grade B and 1 Staff Grade C. An order to take forward the implementation of e-health record. The Food and the Health Services Panel was consulted on the 15th of December. Present for this meeting, we have from the administration Ms. Lee, Mr. Richard Yun, Permanent Secretary for Food and Health, Mr. Sidney Chan, and Ms. I.D. Lee. The chairman of the Health Services Panel, Dr. Lee Kwok Lun, is not here. Then on behalf of Dr. Lee, I will briefly report the deliberations of the panel to you. The panel discussed the administration's proposal to retain the 2 supernumerary AO posts, directorate posts in the Bureau for a while. While members in general supported the proposal, some had some views on the term of the office, and a member disagreed with the repeated extensions of the post. According to the administration, this health record scheme is a 10-year scheme to be implemented in 2 phases. Phase 1 was implemented in between 2009-10 and 2013-14. The e-health record Bills Committee is now scrutinizing the bill. If the bill is passed, then Phase 1 of the system would be launched in the latter half of 2015, and the administration would seek the necessary funding for implementation of the second phase. As the head of e-health record will be the coordinator of the scheme and would discharge the statutory functions and powers under the ordinance. It is necessary to extend the 2 supernumerary posts for another 3 years to provide the necessary directorate support to the head. The administration will first, depending on the progress of the second phase, the administration will consider in early 2018 whether the 2 posts have to be further extended. Does any member wish to speak? Dr. Kwokaki, 4 minutes. Chairman, I support the 2 posts. However, I have a question. In the BC set up to scrutinize the bill, there were disputes about the safe as well as the confidentiality of data. We want to ensure that the program can be acceptable. However, in the Bills Committee, both the public and the Privacy Commissioner have concerned because there is no provision for safe for the data to be established. In the paper, it is said that this will be done in the second phase, but I'm still not too comfortable. Now, the administration is asking for an extension of 3 years for the 2 posts. Is it confident that there will be a better data privacy? There will be setting up of safe for the data, so that the program will be acceptable to more patients. Because in a recent BC meeting, we're told that the administration and the hospital authority are consistent in that a patient has no say as to whether his health records maintained by a private healthcare provider can be made available to the public healthcare sector. So the patient has no say over this connectivity. So I'd like to know how much time will be devoted to resolving these matters by the 2 incumbents, because if these are not done properly, then the scheme is not going to be acceptable. So billions of dollars will go down the drains as a result. Anyone? Deputy Director. Deputy Secretary. Thank you. Regarding this data security issue, now we are talking about extension of the 2 posts. The bill was introduced to the Council in last April, and now is being examined by the Bills Committee. All these issues raised by Dr. Kwok are being discussed by the Bills Committee regarding a safe for data. We have no intention to include this in the for the time being, because e-health record is being developed in other parts of the world, and for the hospital authority, it has got a big data bank, and it is at more privileged position to implement e-health record. Doctors of HA will have access to the information, and information on MRI can be fed to the HA, but information from HA cannot be shared yet. As for the setting up of a safe for data, well, we have discussed with the Privacy Commissioner. Members accept that technically it may not be feasible now, but in phase 2 or stage 2, we're going to consider the technical feasibility, and we will discuss with the Privacy Commissioner to see whether there are provisions in the bill to ensure legislators and to give us enough flexibility. So the 2 posts will consider in the second stage whether a safe can be set up. And CT, MRI are not yet included in stage 2, so in stage 1. So stage 2 will consider this possibility. And then in stage 2, a platform for patients will be considered. In stage 1, due to privacy and security considerations, patients cannot manage their own data in this system. In stage 2, when it comes to access control for patients, we'll see how this can be done without compromising data security and privacy. As for a platform for patients, now in the BC, members are concerned as to whether the Department of Health will be involved in addition to HA. We'll see how we can address members' concerns and whether technically it is feasible to separate the two. It depends on the operation of the system, because some members of the public may want to just give his consent once, and the consent will apply to both HA and the Department of Health, because in the long term, the e-health records will cover the time when the baby is born, and the information is kept up by the maternal and child health care centers, including the kind of vaccinations given to a baby. So once consent is granted at an MCHC, then consent is already given, and the data can be shared electronically. We understand members' concerns, and details are being discussed in the BC. So are you sure that in these 2 years, the question about a safe for data can be dealt with? For sure. Please be more succinct. Yes, stage 2 involves further steps, such as inclusion of information from Chinese medical practitioners and MRI information, and also a platform for patients. And we'll also have to deal with the question of a safe for data. Mr. Buchen, I have no intention to focus on this posts, because even if the administration is going to create another 100 posts, it will still be able to justify it, because under the accountability system, lots of posts were created, and they're going to do the same for the Innovation and Technology Bureau. The question is, the directorate establishment has been inflating very quickly, very rapidly, and spending a lot of money. This trend is very worrying. I really resist the creation of new AO posts. We have the feeling that AOs are creating more posts for their own rank and grade, so that their colleagues can be promoted. All right. Perhaps AOs use this as a way to counter this idea of communists ruling Hong Kong. They want more AO posts. So I asked the administration to conduct an in-depth study. How come we have seen so many new supernumerary posts and their retention? I asked a question at the panel, and I'm grateful to the administration for providing this information regarding the number of supernumerary posts created. If you may refer to this paper, Chairman. Paper ESC 42-1415/01.
The growth in the overall establishment, I think it was already the highest last year, 2013-14. I think this year we're going to have a new high. It is even more alarming that as far as the increase in number of supernumerary posts is concerned, 2014, 2015, 34. Every year in the past, the maximum was only 18. Sometimes there would only be an increase of 10 such posts. Compared with certain years, we're seeing a threefold increase, or at least the increase is twofold. This year is even more alarming if you include the extension of the supernumerary posts. So this trend, I think we need to put a halt to this trend. Otherwise, we'll be simply asked to rubber stamp all your proposals to create these posts. Over the years, we have built up a system. So I'd like to know what is the reason. It's not that the AOs cannot, perform, but rather the government is not capable of making decisions. Sometimes after the AO have something done certain work, they will need consent by the politically accountable officials, but they are laymen leading the experts, and sometimes nobody even dare to make a decision. For For example, the investigation into corruption involving Mr. Donald Zhang, the investigation had gone on for 3 years without any result. So I'd like to ask why we are allowing such an explosion or a proliferation in the number of supernumerary posts. I think you can if I were to open 100, additional warrant officers, I can easily also give you reasons or justifications. Thank you, Chairman. Every year in the budget, we would include many budgets for the establishments, including for the coming financial year, the posts which have been approved by the FC. But all along, we have followed the same practice. That is, for each and for every time we have an increase in permanent or supernumerary posts, they will need to be approved by the ESC one by one and subsequently vetted by the FC. So the justification for the creation of each and every post would be explained in the relevant papers. So every year in the budget, there will not be any hard target as to how many posts would be deleted or increased for that year. It would all depend on the departments and the policy bureaus, which would come up with these proposals based on its own policy considerations. And then in the budget, we will reserve the funding and submit it to Council for approval. Ms. Leung referred to how do we vet the proposal to create any posts. Regarding the number of supernumerary posts, according to the paper, we're saying that during the electrical session, we are submitting proposals. Please speak closer to the microphone. I have a sore throat. I'm sorry for that. Regarding the actual figure, you must note that there is, a deadline for the approval of the. There's a deadline for the or expiry date for the supernumerary post. If members refer to paper 11, you note that the total number of supernumerary posts up to January this year is 58. It was 60 in the year 2012, so the figure is more or less the same. We have Sid Ho, Emily Lau, Yu Wing, and Starry Lee who would like to speak. I would also like to propose that we extend our meeting by no more than 10 minutes. After Ms. Starry Lee has spoken, we will adjourn. So the next member to speak is Sid Ho. Thank you. I'd like to focus on the terms of reference of the proposed post. I understand that the incumbent for this post is to implement the various statutory statutory duties as provided for in the Electronic Health Record Ordinance. And some members have raised the question regarding dishonest use of computers. Anything involving leakage of personal data or theft of personal information. I think there are already other ordinances to regulate such malpractices. However, as more and more data are stored by computers, the administration is now resorting to a shortcut and is relying on the the dishonest use of computer ordinance to regulate such irregularities. And nowadays, I think smartphones are very, very popular, and even if we touch the screen inadvertently, we could easily fall into a trap. So that's why we've been saying that we should be tackling at the behavior in formulating the terms of reference, rather than relying on the improper use of computer ordinance. Could the civil servants who are professionals, could you tell us for the creation of this post, the incumbents, what will they do when they enforce the relevant legislation? The computer is only a medium. The actual theft, you should be focusing on the actual theft of personal information instead, rather than focusing on the way he used the computer. Now, who would like to answer the question? Madam Secretary, first of all, I must emphasize that the commissioner, the head, EHR has a lot of duties, such as enforcement, issuing guidelines, so that people who participate will have the clear guidelines to follow. As for persecution and enforcement, I'll ask the director to answer the question. The Bills Committee indeed had discussed the question of how we should deal with certain offences once a new system is commissioned. We have said that before we have the ordinance, the current legislation will apply, including the personal data privacy ordinance and the dishonest use of computer ordinance. We will rely on those legislation to prosecute those who improperly, who would are guilty of malpractices. For example, people who would, destroy the system or stealing data from the system for sale. If there's any malpractices in the future, are we going to use the provisions, the new ordinance, or should we rely on the existing ordinances to prosecute? Will depend on the circumstances of the case in question. If somebody, smash up a computer, it may be more appropriate to prosecute according to the, improper use of computer ordinance. I mean, that will be the decision for those responsible for enforcement, and it would be the police instead of our office. Emily Lau. I really support the electronic health record system. The HA is already implementing the system. I hope that you will really promote this amongst the public. But at the Bills Committee, the previous commissioner complained that you have not listened to his advice. I don't know who is telling the truth anyway. And members have given you some suggestions. Please try to, rationalize the whole scheme so that the bill could be scrutinized successfully. We all agree that we should be able to protect personal data and privacy and respect the wishes of the patients. I hope that you really do it expeditiously. You really need to step on it. We hope that we'll be able to listen to the views from all the stakeholders so that we can address those issues at the Bills Committee. And once the legislation is enacted, we will implement this as soon as possible so that the public will have more choice and get more protection. Thank you, Ms. Lau, for the reminder. We fully understand that. And actually, we are dealing with those issues with the Commissioner. Certain conceptual issues, for example, the question of the so-called safety box is very controversial. The important thing is that we shouldn't implement that at this stage because we don't have the technical foundation to do it yet. We are now, talking to the commissioners to which wordings we should use. So I'd like to thank members for the support. Mr. Yu Si Wing, thank you. I also very much support the proposed arrangement. We all know that if we go to different hospitals, the patient has to queue up once again and go through the same test again. It would be a waste of time, not to mention the money. And the health of the patient may suffer as well because he may need to take, more than one X-rays. In 4B, I note that when using such system or data, including medical, including provider of medical services, which has a very cover a very scope. Of course, doctors certainly need such information. What about the nursing staff? I mean, what should be the limit? When you draft the legislation and the guidelines, I hope you will be clear so that the patients and the families would know the extent to which the personal data would be disclosed so that their personal data and privacy could be protected. that is something that we will certainly do. And this is also something that we are discussing with the Privacy Commissioner. Other than the authorization, there would also only medical personnel who has a need to know can access the electronic health record of the patients, namely the patient that they need to treat. So in other words, under the main ordinance, you cannot provide for all those details, but we are given the authority under the ordinance to issue guidelines. Even private hospitals have such guidelines as to who are the personnel who can access patient records. Mr. Yu Si-wing. I think this also includes the clinics, and then there are nurses working at clinics. Of course, you have to ensure that the medical staff would need to have access to the information of the patients. But I think at least you should define clearly the boundary. That is the scope for both hospitals and clinics, respectively, as to what sort of data they can access. For example, can nurses working at private clinics also access such information? The simple answer is that there will be such guidelines. The system in future will record whoever has access to information. So it's not just the guidelines spelling out who can access the data. There will also be a locking system. We will know on which particular day and what time which was the person who has access to the record. So we can easily follow up who has access to information and whether or not he has been authorized to do that, or whether or not he was authorized to access such information. Mr. Yu Si-wing, any further questions?
Mr. Riley, thank you. Just now I heard Mr. Albert Chen say that the government has been increasing too many supernumerary posts indiscriminately. I cannot help pressing the button to speak, because I've heard on many occasions from civil servants that they are under great pressure and they have a heavy workload. They have to come to answer members' questions. They are being scrutinized by the public, and also the new workload created by the CE in its policy address. I'd like to ask the administration whether there has been any survey on the stress faced by civil servants. And secondly, of course, I cannot support your proposals blindly. I'm not too worried about these posts because you have job descriptions, and many of the duties are already being discharged. For instance, drug testing, they have very clear job description. But as time changes, some posts are no longer that important, or the workload is already lessened. So is there any internal mechanism for you to review existing posts? And for this post, in my past discussion with you, I have a great concern. I believe that e-health record is an excellent arrangement. It's good that there can be sharing of records. Unfortunately, there is no timetable for doctors in the private sector or clinics to be included. What is your time frame? Can this be done within the term of the posts? Mr. Mack, please take the question about CSB's review, and then please answer the questions in relation to this paper. Mr. Mack. Thank you. Mr. Riley has raised two questions. For the CSB first, the work stress faced by colleagues. It is hard to quantify stress, but we have day-to-day contacts with civil servants. It's true that civil servants have new duties, but the civil service is a dedicated team. Whether our workload is heavy or light, we will discharge our duties in a dedicated and professional manner. Secondly, creation of supernumerary and permanent posts and the mechanism to do it. whenever review staffing proposals from a bureau, we will consider very carefully whether the duties are new. If yes, whether they can be taken up by redeployment of resources and rationalization of duties. We will only submit a proposal to the ESC after we are satisfied that creation of posts is the only way. In all ESC papers, we will mention alternatives considered to be accountable to members. Thank you. We are at an advantageous position to develop HR sharing system because of the big infrastructure held by the HA. 400,000 HA patients already involved, and there are 3,500 healthcare providers in the private sector. Our understanding is that private hospitals will join the scheme, and all medical healthcare personnel attached or associated with private hospitals would be likely to join the system, and we will use the public-private sector scheme to alleviate the burden of the hospital authority. And doctors in the private sector who join the scheme will also have to join this public-private sector collaboration. So we are quite confident. Yes, I hope at a certain date you can require all private doctors to join the system. I think this is in line with expectations of patients. Yes, after we have implemented stages 1 and 2, if people are aware of the benefits and are confident in data security and privacy protection, I'm sure more people would like to join. Thank you. This paper will be carried forward to the next meeting. So the meeting is adjourned now, and the next meeting date is the 11th of February at 8:30. Thank you very much. Thank you, officials.